when one of the things too that I've noticed was kind of your state going into the illness. So example, with the current like the Rona thing going on,
Uh-huh.
that people that go into it real fearful, I mean, the
Mhm.
fear is going to work to kind of suppress your immune function.
Totally.
And then it will make your response and everything in your body respond in a more over aggressive manner,
Mm.
which is really where a lot of the negative response comes from. The way the
Mhm.
things that because nobody dies from the virus, they die from your immune system overreacting to it. So
Right.
so that's kind of part of it is emotionally going into it with a positive, like, yeah, I got this, we're going to do this, versus a fear response. I think that that's a big one. And
Hmm.
that's because one of the things that I've realized in the last almost 2 years now, is the main issue is not having fear, because what everyone is afraid of is an untreatable illness.
Mm.
And so they have to know in their heart, they're like, wow, there are a lot of treatments, but like you're saying, they're not the standard treatments that are being offered on a main level at the hospital, which there's all kinds of reasons for that.
Hmm.
But the idea is that if you can move around your daily with not living and dwelling in the fear. Again, fear can knock on your door every day, but you just don't open that door. You close the door and lock it. And you're like, no, thanks.
Hmm.
I'm not going to take that pill today. And so, but I think that's a huge part to like maintaining your health freedom, is also not living in fear
Yeah.
uh, of it. And so that I've noticed a big difference in how patients respond to, based off of how they came into it emotionally.
Mm-hmm.
So, and also letting patients know that there are unique options for them, short of hospitalization,
Yeah.
uh, prior to that,
Yeah.
then that gives them such a sense of peace and confidence that, okay, then my body can handle this. But it's that knowing that, like, oh, there's something you can do about it. So it's
Mm-hmm.
that empowerment. Because again, the thing that steals your power is when you think there's nothing to do about something. That's
Yeah.
whether it's in a relationship, or on the freeway, or you're stuck behind a big truck on the freeway or something, or you don't feel like you know anything about it, or in like a chronic, like an acute infection or a chronic infection or illness. If you feel like there's nothing to do about it, then that is super deflating to your emotional system, and
Yeah.
you basically get into a degenerative state where your body will start to break down, because it's thinking that you have no hope.
Mm-hmm.
So that's where, as soon as you can realize that there's so many solutions for so many illnesses, including some current infectious ones going around, then that level of hope and confidence goes, oh, okay, I can do it. Because I remember example was, is if a doctor came in and say, Dr. Matt, maybe you had been infection in your toe, and the doctor comes in and goes, sorry, that's going to take you out. We don't have a treatment for it. Maybe get your affairs in order. That could be a potentially fearful event.
Mm-hmm.
But the same doctor 5 minutes earlier walks in and goes, oh, here, take these pills and this medicine, and in a week you'll be better. Well, it may be painful, but it's not fearful. You're like, okay, thanks. Sorry, I'll just have to put up with some pain for a week.
Yeah.
And so, same doctor, same infection, different message. One
Mm.
evoked fear and hopelessness. The other one evoked confidence and no fear and ability
Yeah.
to heal. But same infection, same doctor. So really, if you are having someone telling you there's nothing you can do about it, then that if you allow it, it will allow that fear to kind of come in, unless you can look and get empowered, be like, no, there is stuff I can do about it. So I
Yes.
think that's a big part of it too, is checking the message you hear, and really looking for like a confirmation on whether it's truth or not. Because
Mm-hmm.
that search for truth and following your heart, I
Mm-hmm.
think, because the heart often tells you what's true or not. I think we can be programmed in the brain, and we can be brainwashed in the brain, and that happens
Yeah.
all the time. And modern media is basically brainwashing. That's what it's been doing. And I
Yeah.
saw this happen full force in February 2020 to March 2020. Kind of really came in effect, and the message was, the boogeyman's coming. The boogeyman's going to get you. There's nothing you can do about it. The police can't help you. If you have guns, those won't help you. Oh
Mm.
yeah, and the boogeyman might come through your loved ones, so don't be near them either. And so
Yeah.
that was the
Yeah.
message: was fear,
Mm.
fear, fear. No one can help you. No one, you traditionally, they can help you, and you shouldn't be around anyone else because they might hurt you. And
Yeah.
so that was that message, which is, if you don't know better or have someone in your life speaking truth to you about it, then
Mm.
a lot of people believe that, and they went into a deep fear state, which
Yeah.
then is critical for making poor decisions, and letting people then tell you what to do that are bad
Yeah.
ideas. And then,
Yeah.
but the heart often still recognizes truth. So if even though a lot of people have been programmed in their brain, like, and I mean programmed in the actual like brainwashing sense of like one might think in like a Russian spy movie from the 70s.
Psychological warfare.
Yeah. Oh, totally. In U.S. military psyops, it's all well documented. All the psychologists can talk to you about it. Is the idea is that a lot of times when you hear truth, there can be a heart-mind conflict, and then there also can be like they call it like cognitive disconnect, cognitive dissonance, where what you're been programmed does not match up with the truth that you're feeling, and so then therefore it actually can be neurologically almost painful to experience that if you've been living in this other programming, but your heart's and your mind's like saying, well, no, something's different. But it actually, and that's where you've been getting this weird response with family members, where you family or friends that were some family and friends will actually get aggressive and angry at their family and friends that otherwise they've never done that in their life.
Yeah.
And because the family friend that's receiving that anger is totally shocked and not sure why. It's because that other person was living in a programmed state, and then there's this cognitive disconnect that then causes it it's almost like a pain response that the person goes, "Don't talk to me about it. I don't want to hear it." You know, which again is, and so I think part of that is based on that person got into that state from initially getting into a fear state, because fear state kind of pushes you out of your frontal cognitive lobe into your primal like survival center. Yeah. And then you don't have the ability to process and reason in an appropriate manner, and then to assess good idea, bad idea, good idea, bad idea, good idea, bad idea, bad idea. You know, so the idea is that all of a sudden it's just whatever comes at you then is now your idea. And so I think that part of because a lot of people, and I've had some patients too, to kind of jump into it too. I've had some patients that have been on the emotional level very distraught, and it affects their health because they've run into problems with close family members and friends that they might have been friends for decades, you know, and family members obviously for their whole life. And so that now there's these schisms that have occurred and rejections of family members that maybe don't agree in certain ways with the other family member, and where they get these aggressive emotions coming at them from family members, and they're not sure why. And so when it kind of go back to the healing state right now, especially, is you have to help that person figure out how to realize what their family members have gone through and why they're coming at them with that kind of irrational sense and anger and kind of attack often, and get a level of compassion for them, knowing that they're in a state where it's actually very hard for them to control that because of the programming that they've opened themselves up to. And then once people kind of realize that, it doesn't fix the situation perfectly, but then they get a perspective of like, oh, it's actually almost like they have like a parasite or a leech or a some kind of like, you know, problem going on that's causing this. So it's not actually that inherent person. It's this conflict that they were programmed with. And so, which then can give them a little more almost compassion for that family member that's being angry at them, which then kind of frees them from feeling like they did a wrong, which then can hopefully help them liberate themselves in their healing process. But that's something that I've really realized is that conflict, and a lot of people feel abandoned by close family friends if they are choosing to look at the world situation in a different perspective than the mainstream narrative. I mean, I don't know if you imagine you've seen that kind of thing with your patients too or not, but
totally. Yeah. I mean, it's it is crazy. I mean, all the, you know, the grandkids that people can't see, or the
totally
daughter or the son, or you know, somebody is just I mean, literally paralyzed by fear of either what they're going to do to somebody else, or that person, what they think somebody else is going to do to them, right? Completely outside of the realm of any kind of scientific validation, medical validation. It's like,
totally.
That is, you know, it's I mean, that seed, I think you just, when you sow that seed and you keep watering it, you know, for 2 years, and I mean, it starts growing, and those roots go deep. And unfortunately, it usually tends to be that way, where it's the negative thing, or the fearful thing, the worry thing, that those roots go deep in, rather than, you know, because you kind of just have to take conscious effort to go the opposite way, right? I mean, you have to consciously right now, you'd have to search out for positive, uplifting, hopeful. I'm not saying exaggerated. I'm talking like just legitimate, hopeful, health opportunity that's out there amongst, the mess we got going on. You would have to consciously be searching that out and looking for it. Whereas if we just go through life, and we're just like, kind of whatever comes through our ears, whatever comes before our eyes, that's just whatever.
Mm-hmm.
We are going to be hurting. We're not going to sleep. We're going to be in a state of worry. Our body is going to be depressed. We're going to fear everybody around us. We're going to think that, we're walking through minefields all the time, when it's so false.
It doesn't match reality. Yeah,
it's so false, but I keep thinking we're gonna come out of this, or there's gonna be enough voices out there that are propagating authenticity related to the opportunity for hope, the opportunity for light at the end of the tunnel. Unless these, that's where we are. That's where we come into play to help each individual patient that sits before us say, hey, what? Okay, this is reality right here. And you're basically gonna have to choose which reality you want to live in, because you're creating a reality over here based on all these inputs you've been receiving. What if, for a time frame, you start receiving these other inputs, legitimate inputs, authentic inputs, inputs that are true, but have essentially, it's like saying this, okay, so getting the flu. Who wants to get the flu? That's not going to be fun. I don't want to get the flu. I'm not trying to get the flu or any other infection out there. But there is a group of inputs that would say, man, if you get the flu, you're probably going to die. You're going to be in the hospital. Life's going to be really rough for you. And there's another group of inputs, which is not, people die of the flu. That is a fact. People die
absolutely.
in response to the flu. We're not saying that doesn't happen. But at the same point, the majority of people, especially if you're taking reasonable care of yourself, there's no way that would be so unusual to happen.
Right.
So you could be in this entirely different camp, listening to entirely different voices that are also giving you authentic truth. And your entire being, your entire life would feel totally different, because you would think that you're walking through a minefield every time you go in the grocery store, every time you go to Thanksgiving, to Christmas, any of those things.
Totally. Yeah.
I think that's we have a huge role. And we were talking about, even before we got on here, about, even thinking about, should we talk about practitioners, or should we, how could we support practitioners? And saying, hey, let's live above fear. Let's not promote fear to our patients. That's not helping them out. We know 100% that it's not going to help them out. They're not going to get better. For sure. Let's promote an opportunity. There's an opportunity here.
Yeah.
If your heart is beating, if you're alive, there is
an opportunity to have another beat.
Yeah, exactly. So
every beat gives you an opportunity for the next.